Hi, ladies and gentlemen. Welcome back to Brain Gists and Happy New Year to you guys. It's been a very long time. I hope we're all doing very well. So, today I want to talk to us about ulnar nerve disease. It's not unusual to see some people coming with numbness, pain, tingling in the hands and in the forearm, you know, and you might be wondering what causes it. I did a video just before the Christmas break about carpal tunnel syndrome as one of the common causes for that. But today I'll be talking about another condition which is equally common and affects the nerves in the hands and causes numbness, pain, and tingling. And this one is due to a disease of a nerve called the ulnar nerve in the hand. So in case you're new to the channel, welcome. This is Brain Gist, where we enlighten people about the brain, the nerves, the spinal cord, the muscles, and everything that has to do with the nervous system, all that you need to know about. So if you like what you're saying and about to see, please subscribe and turn on your notifications so you can benefit from all of the videos that will be coming off this channel, right? So today I'm talking about ulnar nerve disease. So you first need to understand what the ulnar nerve is. So there are so many nerves in the hands, and one of such nerves is the ulnar nerve. So the ulnar nerve actually travels all the way from the neck, where all the nerves in the hands originate, and it travels and goes behind the elbow here, and then travels all the way down to the hands, and usually it controls this last two digits. Just for the sake of simplicity, I'll say that. So those who have disease of this nerve would usually complain of either numbness if it's two fingers, the small finger and then the ring finger as it's called, and then sometimes the inner part of the hand also, they have some pain, tingling, and numbness in these areas. And numbness usually refers to the feeling that your hand is sleepy or you're not feeling well. The commonest site where this nerve is injured, the ulnar nerve, is around the elbow. And so it's also not uncommon for such individuals to complain of some pain, ill-defined pain or some form of difficult to describe pain that shoots down all the way into the areas of the hands. And I must quickly say that ulnar nerve disease is not the only cause for these symptoms. Okay, so you would usually need an experienced physician or a neurologist to examine you and decide if this is ulnar nerve disease or it's something else. So the commonest site of disease of the ulnar nerve is around the elbow in young people. So this nerve easily gets compressed because as it passes around the elbow here, it's very, very superficial. So think about the fact that as we bend the elbow and extend the elbow, we're actually stretching the nerve, and the nerve calls back. So this repetitive stretch actually makes the nerve vulnerable, and it hides somewhere here. But what actually contributes the most to its vulnerability to injury is the fact that it's quite superficial here. So just merely leaning the elbow on the table or on an armrest puts it at risk, because what happens is it's already lying on top of the bone with an overlying skin. And when I do this, I'm now sandwiching the nerve between its bed of bone and then a hard surface. So the nerve receives a hit, a minor injury, and when this continues repetitively over a long time, then the nerve sustains significant injury and it starts to give you symptoms of numbness in the areas supplied by the nerve. And if this actually lingers on for a very long time, you may start to lose some of the muscles in the hand that are supplied by this nerve. So the way I'm resting my arm on the armchair now is actually not correct. Usually the arm should be free, so that you don't compress your nerve in that area where it's vulnerable. So in young people, that's the commonest cause, and of course in older people, there are some of the reasons why they could have ulnar nerve disease. So when you sit at dinner or in chair or wherever, do not lean on your elbows. So for those who have ulnar nerve disease, when we examine them in the clinic and we pick up signs that convince us it's ulnar nerve, we usually would do nerve conduction test, which is a test I talked about in past, and that helps us to confirm the ulnar nerve disease. And once this is confirmed, we may or may not do needle EMG in addition to that. And once that is confirmed, then we go through treatment. And the first and most important thing is you must stop compressing the nerve, because compression is the commonest cause of injury to the nerve. Like I'm leaning my hand on the elbow on the tape on the armrest now, I'm actually compressing the nerve or potentially compressing it. And then the second thing is once you stop compressing, sometimes then it starts to heal and the pain begins and symptoms begin to recede. And if that's not enough in some of the people, we may have to splint the elbow a little bit. We'll prescribe some elbow sleeves that limit the extent of movement across the elbow, because in the nerve that's already injured, repetitive motion also tends to aggravate the symptoms. We may have to give some sleeves, and that's to wear in the day or at night, especially for those who wake up in the night with numbness all over. And if that fails, some of our colleagues now are doing some injections around the nerves. Some pain doctors do that. They, on the ultrasound guidance, we're able to inject some things to either hydrodissect the nerve or to reduce inflammation around the nerve. And then the third thing that we can do, or the fourth thing now, depending on whether you're actually paying attention and counting, the fourth or fifth thing we do is some of our colleague physiotherapists are able to do some things, some maneuvers in the nerve to help, reduce the discomfort there. And if all of these things fail, the final thing is usually surgery to kind of, make the nerve more comfortable in that area. The surgeons will go in there to either mobilize the nerve where it is and put it in a less vulnerable area. All right, I do hope that you learned something from today's presentation about ulnar nerve, and if you did and you like this videos, like it, subscribe, and of course hit the like button, drop your comment, and turn on your notification. So this is all I have for you today. I do hope to see you again on my next video. Thanks for watching today, and goodbye.